Okay, item 3, consider approving a grant provided by the Colorado Department of Human Services Behavioral Health Administration to the Mesa County Sheriff's Office Co-Response Unit in the amount of $300,000 and authorizing Commission Chair to sign the grant. Henry Stoffel, Division Chief, to present.
Good morning, Commissioners. Henry Stoffel, Division Chief,
Stoffel.
Mesa County Sheriff's Office. Mesa County Sheriff's Office Co-Response Unit pairs a post-certified deputy with a behavioral health specialist. They respond to calls involving individuals experiencing behavioral health emergencies. The goals of the co-response unit is to de-escalate the situation so use of force does not occur, identify services that the individual needs, and redirect those individuals away from critical community infrastructure and get them to community-based services. This has saved a lot of time in hospital emergency rooms and diverting people away from the Mesa County detention facility. After the connection is made with the community-based services, we continue our follow-up with those individuals to make sure that they continue to receive those services that we try to provide. Having an active co-response unit allows limited patrol units to focus on criminal incidents and public disorder. In 2025, the Mesa County Sheriff's Office co-response unit responded to over 1,500 calls for service and successfully diverted over 300 individuals away from these communities' critical infrastructure. If awarded this grant, or when you sign off on this grant, it'll be used to fund 2.5 of the 4 positions of our clinicians, our behavioral health specialists, so we can continue this very valuable program.
Okay, Commissioners, do you have any questions or comments on this item?
No questions, but it's a good program. It puts people back in the community where they belong, raising kids, going to work, things like that, rather than sitting in jail is the goal. And good program.
Without getting on a soapbox, Commissioner, what it's done is it's placed people where they need to be. Jail is not a place for someone who's suffering from a mental health event, and getting them to the services and that are community-based is very effective for reducing our average daily population. So it's important and we need to continue this program.
Thank you.
This is definitely a return on investment. We do spend in the jail, especially, it's astronomical. Healthcare, all of it is very taxing for the taxpayer.
Yes.
And this really does have a massive return on investment in more ways than one. Yes, we're seeing some returns in taxpayer savings, and that's definitely a plus. But if we can get these folks that are experiencing probably the worst day of their life, services, and Mesa County is uniquely set up in that infrastructure. We have Department of Human Services, we have public health, we have so many different areas that we can serve our community, and they don't need to be in jail. So definitely full support of this program.
Thank you.
Thanks.
Yeah, I guess my question would be, how does dispatch distinguish, I guess, what a call comes in to 911 to the call center? And then how is it determined, or how is it distinguished that, okay, we can maybe just escalate the situation, and then what's the time frame to get the team together and go out to the call?
So right now we're having coverage 7 days a week for about 14 hours a day. We looked at where our majority of calls for service are at, so we try to match that with the teams. Right now we have 2 deputies and a sergeant along with 4 clinicians. So they are on duty. When the call comes in, dispatch does a very good job of identifying what the call is. If they can identify that this is an individual who has a known history, and we can send a co-response unit in lieu of a patrol team, that's better. Oftentimes a patrol officer will respond first and say, well, I need assistance with the specially trained co-response unit, and then they arrive. It usually occurs within 10 minutes that we can get somebody on scene.
Okay, thank you for that. All right, does anyone in the audience have a question or comment on this item? Okay, seeing none, I will entertain a motion to approve the item as published.
So moved.
Second.
All in favor?
Aye.
Aye. Motion carries 3-0.
Thank you.
Thank you, Henry.